Hey everybody, I'm Dr. Russ Hornstein, and I'm probably just going to have a little bit of a rant here uh, about how muscles are tight. Like everybody's got tight muscles. Why are your muscles tight? It's often the same thing. Uh, so we all know we can have tight muscles. And you can go to a massage therapist, you can have it massaged, and then the next day it's going to be tight again. You can go even to a chiropractor, you can adjust it, and 2 days later it's going to be tight again. Why are these muscles getting tight all the time? It's actually a really, really simple answer. It's honestly one that very few people understand, unfortunately, and I'm stand on every soapbox I can and try to explain at least what I know and what I understand of it. So I'm going to try to be as brief as possible and make this as relevant to as many people as possible. Um, when we have muscles that are tight, uh, we have to say, is that happening for a reason? Okay, so firstly, is the body just doing something wrong? Is it wrong to make these muscles tight? And then if we make them relax, the body will go, oh, that's the way it's supposed to be, and just stay relaxed. Generally not. I mean, generally those muscles are tight for a reason. And the muscles that are tight um, are often what we call type 2 muscles or fast twitch muscles, or muscles that are designed to move us rather than muscles that are designed to hold us. So, yes, we have two different muscle types. We have what we call slow twitch muscles that hold us, and we have fast twitch muscles that are used for kind of explosive forces and big movements. Okay, so if you're jogging, you start using the type 2As. If you're really exploding and jumping and jumping and jumping, it's type 2Bs. You're using more powerful and powerful muscles to move you when you're doing fast explosive motions. But if we're not doing that, those muscles shouldn't be working. And the muscles that should be working are just the ones that hold us. Now, those muscles, the slow twitch muscles, they usually don't hurt or create pain. You know, there's tension when you're sitting up and doing things, but then when you move, they relax. You know, they respond to how your body is moving and your position in relation to gravity. They're very gravity sensitive. And when those muscles are working well, your body is only using as much energy as it needs to hold yourself up, and all the rest of the muscles should be as relaxed as possible. So if your type 1 muscles are working well, you shouldn't have any perceivable tension in your body. Your body should just feel soft and buttery, except for when you want to go and do something. So why is it that we see tension in people's bodies? The reason is because those type 1 muscles, those slow twitch muscles, are not working. They're not working as well as they could. And what the body senses is it's trying to make something happen, like try to hold your joints together or keep you upright. Um, and if it's telling those muscles to switch on, but they're not switching on, it's going to start to work harder and harder and say, oh, we must have to apply more and more force. And there's a principle called Henneman's principle, which is basically that the harder you work, the more you recruit these other fast twitch fibers. And this is essentially what's happening. It's like if the first person in line that's being told, you do your job, doesn't do their job, then the foreman has to shout louder and louder and louder until the other guys kind of pick up the pace. And that's exactly what we're seeing, is that these fast twitch muscles are switching on, trying to compensate for weaker tonic muscles, and muscles that should be stabilizing you and holding you are now having to contract to try to, or they're supposed to be stabilizing. And if they're not able to contract, then these phasic muscles are going to start switching on. And that's when we start experiencing problems. And the reason is because these muscles are meant to contract and relax, not meant to contract all the time. They're for explosive forces, okay? They can contract very powerfully and really accelerate our body and our limbs and make us do amazing sports things and activity things. You know, they're incredible muscles, but they're really not designed to be contracting all the time. So if they are, they will usually fatigue quite quickly. When they fatigue, they start to go into like more of an anaerobic phosphorylation, which means that you're using energy anaerobically, which means you're going to produce lactic acid. And everyone knows that lactic acid in your muscles isn't great. It's this whole phasic or fast twitch muscles that are working too hard to try to make up for the underlying tonic muscles. So in other words, the main muscles that should be holding you up should be stabilizing you, And they also control the movement of the joint as well. So they're very, very important muscles. So they're really controlling the precision of the joint motion and giving the joint stability, holding it. But then as you need to move, they relax and they change according to your needs. They're very, very gravity sensitive. They do that very, very well. If that system has been switched off, and I'll explain why it does and how it does in a moment, but if that system gets switched off, our body has to go, oh, I need to work harder, harder, harder. And then through this sort of size principle of Henneman's, you're going to start to recruit these type 2 fibers. And those are muscles that are meant to explode, but you're going to try to make them just contract and hold you. And what that's going to do is, again, going to create fatigue, lactic acid, pain and discomfort, stiffness, lack of mobility, all the things we often complain about our joints are happening as a consequence of these fast twitch muscles compensating for the lack of the slow twitch muscles to do their job. So beyond that, what's happening is that kind of compensation is going to be, once it engages, it's going to be on all the time. So even when so normally your tonic system, your slow twitch muscles will be switched on when you're upright. But then when you lay down, you can really see those muscles calm right down because, there isn't as much load on your body from gravity if you're just passively laying somewhere. And certainly if you're not exploding with force or movement when you're laying down, your fast twitch muscles should be relaxed as well. But that isn't usually what we see. What we usually see is when there's a failure of the slow twitch muscles and the failure of the tonic system, what we'll see is that recruitment of these fast twitch muscles will be there all the time. So even when the person lays down, there's still going to be tension in the system because your body, those muscles are not, the phasic muscles, those fast twitch muscles, are not sensitive to gravity like the type 1 muscles are. They're on a different circuit. So we call the tonic and phasic systems. They're different circuits of sensory, integrative motor control, and they don't follow the same rules. So once those fast twitch muscles get switched on, even when you lay down, you're going to see you still have tension. You lay down on the massage couch, the tension's still there. And that's what's happening is these muscles are being recruited to make up for the tonic muscle failure, the slow twitch muscles. So how do we fix it, right? It should be easy. And actually, it really is most of the time. But what we have to do, there's a longer answer, really. What we have to do is to learn how to diagnose for failures in the tonic system. This is what we do with adjusting to neutral, is we look at that system first and where that system is failing. And if we can determine where that failure is and resolve that, then essentially we can switch the tonic system back on. And then we see all those phasic muscles just melt away. Like we literally see someone after we treat them, the muscles just melt away. So they become much more relaxed. And their body is actually working much more efficiently as well, because that's really the way it's designed to work. So why does this system fail? The most common reason that I've seen why the system fails is because what's driving that tonic output, in other words, the brain activation, it's called the vestibulospinal pathway, that fires down to the spinal slow twitch muscles, we call intrinsic muscles, or the slow twitch muscles in our extremities through the lateral vestibulospinal pathway. These muscles are the ones that are going to hold us and keep us upright and keep us essentially aligned to gravity, if you would. Okay. What can throw that system off, that control to turn that whole system on, is when the inputs into that system become skewed. In other words, you have some joints in some positions, other joints in other positions, and your brain is getting different signals and it doesn't really know where you are. And what it's going to do is not know how to respond effectively. So what we'll see is that vestibulospinal output will drop off, and so will the activation of these muscles. And again, these muscles are giving our joints good stability, and that keeps us in a good posture. When that system fails, you start to see the posture start to fail. The head starts to come forward and the person's slumping over. They can't hold themselves up anymore because that kind of reflexive system has been disengaged. So is it as simple as just having a joint out of place? Kind of, yeah, that's definitely one of the key issues. So if that's there, that needs to be fixed, in my opinion. And there's definitely some really, really great ways of doing that. I'm not saying that adjusting to neutral is the only way to do it, but it's one that works very quickly and has very lasting effects. So I would say it's probably one of the better ways, but there are lots of other techniques and ways that we can address and activate that tonic system. So there's many, many ways, but I think the key is, especially for practitioners, is to learn how to diagnose failure in the tonic system. And if we can do that effectively, then we'll have a mindset which will help us to reach uh, uh, principles and techniques and pathways to resolve that system. So, unfortunately, it isn't something I can say, well, just do this exercise and it's all going to balance back out. It's not quite that simple. It does require the input of a specialist. But there's plenty of people around that are doing adjusting to neutral and other great techniques that I think for anyone, any listeners who have these sort of problems, definitely reach out and if I can help you find someone, I'll help you. And if not, just look up adjusting to neutral practitioners. But again, there's many, many ways. This is just one way to manage that. But it's the same principle again and again and again. It's I can go into this in much more detail if anyone has any questions or comments. But just as simply as I can state it, this is why so many people are carrying around tension. Because you can trace it all the way back to a failure in the tonic system. That can usually trace back to some joints that are failing and creating aberrant inputs into that area of the brain that should be turning that system on. And it basically just blows a fuse and it doesn't work anymore. But it can be changed and often very, very quickly. So it's not a difficult thing, but definitely something that should be fixed first. Trying to just make phasic muscles relax by stretching and things like this, it can be effective, but it's not always going to be the longest term or the fastest way, or really the best way, because we kind of have to look at where that issue is starting. And I really think that it starts in the joints and very often in spinal joints and very often in the neck. So many people have sustained neck traumas that if they are not dealt with appropriately, can lead to many, many issues, and this being one of them. But you can extrapolate this scenario and take it all the way through many, many other different types of disorders as well. Because as soon as these phasic or fast twitch muscles are switched on and engaged, we have a much greater degree of load and force in the joint. If we also have that failure, if this is happening, as I explained, is a failure of that tonic, the slow twitch muscles to stabilize the joint and control the motion of the joint. So if that's failed, it's less stable, less able to manage its control. And then you have these very powerful, explosive muscles contracting all the time. That load on the joint is going to accelerate the wear and tear of the joint. So we see breakdown of joints and every cascade of failures very often happening as secondary and tertiary effects of this mechanism. So you can extrapolate in every direction you want. But this theme is core to so many of the physical issues that we have, not only in joints, even in the function of our brain. Again, you can extrapolate in every direction. This is meant just to be a short rant, so I'll stop there. If anyone has any questions, just reach out, and I look forward to hearing from you. I hope that's useful. Thanks.